right, let's face it, every woman at some point in their life will experience menopause. So what can we expect? Well, joining us today to help us learn more about some of the symptoms of menopause and postmenopause is Dr. Streicher from Northwestern University's Medical School and Michelle King Robson. She's the founder of EmpowerHer.com. Ladies, thank you so much for joining us today.
Thank you for having us.
So even though every woman will go through menopause and postmenopause at some time, why are these topics so difficult for people to discuss?
Yeah, you know, you're right. Every woman does go through menopause, usually around the age of 51. And even though this is a natural part of life, this is one of those taboo topics. It's kind of right up there with talking about anything having to do with sexual health and certainly having to do with aging. Women just don't want to have that conversation. They don't want to talk to their friends about it. They don't want to talk to their partner. And sadly, they don't even want to talk to their doctors about it, which is why Michelle and I are here today on behalf of Pfizer, because we think this is a really important conversation to have. And while a lot of women are very much aware of the symptoms they might have around the time of menopause, most women aren't aware that post-menopause, a few years later, that they may have some symptoms that are very different and very unexpected.
So most of us are familiar with the common ones, but what about maybe the not so common ones or the ones in post-menopause, as you just mentioned?
Yeah. Yeah, you're absolutely correct in that most women, if you say, tell me what you think is going to happen when you go through menopause, and they'll say, you know, hot flashes, I can't sleep, maybe I won't be able to remember why I walked into a room. But women are not as familiar with the physical changes that can occur from a lack of estrogen. And sometimes these changes don't start until 2 or 3 years after they've stopped getting their period. And there's a condition called vaginal atrophy. And what this is that the tissues become so thin and so dry that women can start experiencing problems like burning, itching, really, really painful intercourse, so that sometimes they're not even able to have intercourse. In addition, there can be bladder issues, urgency, that, you know, got to go feeling all the time, always looking for bathrooms, painful urination. And women are not aware that this is specifically because of lack of estrogen, and they're also not aware that there's solutions. And one solution a lot of women are not aware of is S-string, which is a small flexible ring that a woman places in her vagina. It stays there for 3 months and slowly releases a small amount of estradiol, which is the hormone that women made before menopause. And this estradiol will help alleviate a lot of the symptoms that I mentioned. But it is a prescription medication, which means they need to go to their doctor, they need to have this conversation, they need to find out if they're a candidate, because like every medication, there's potential risks and benefits. And they also need to know that if they have anything unusual, anything different, as with any medication, whether it's a breast lump or chest pain or vaginal bleeding, they need to talk to their doctor about it. But the main thing is they need to have that conversation and not accept these symptoms as just being a normal part of aging.
Okay, let's talk about the personality and relationships that women have, you know, maybe with their husbands, with their children, with their friends. How does menopause affect those, and also postmenopause?
Yeah, it's such a big issue because so many men think, well, my wife doesn't want to have sex with me. She's avoiding me. What am I doing wrong? It must be me. When in fact, it may just be that it physically hurts, which is, I think, a lot of the experience that Michelle had when she was experiencing some of these symptoms in terms of how it impacted on her day-to-day life and relationships, and that's why it's so important.
Okay, so where can we get more information on this? I know this is something that, you know, a lot of people may consider, especially if they're feeling the effects and it's affecting their everyday lives.
Yes, you can go to estring.com to get more information, and you can go to empower.com.
Empower.com. Okay, well, thank you so much for joining us today, ladies. We appreciate it.
Thank
you.